Thank you for asking this question. I think this is really, really important. A lot of patients and providers don't realize that ovarian cancer has a huge genetic component as far as the causes of it. About 20% of women who are diagnosed with an ovarian cancer actually have a gene mutation that caused it. And that, when I say gene mutation, meaning something that they inherited and something that they could potentially pass on to others, pass on to their children, or be sharing with a sibling. Ovarian cancer is one of the most lethal cancers that a woman can be diagnosed with. In fact, 75% of the time it's diagnosed at an advanced stage. We don't have a screening test for it, so picking it up early is really by luck or by chance. And in women who are diagnosed with advanced stage, the likelihood of them still being alive at 5 years is around 60%. Again, that is because this is a very highly lethal disease. And women who are diagnosed with an ovarian cancer should be seen by a genetic counselor. They should be seen, basically what will happen when they're seen by a genetic counselor is the genetic counselor will go through their family history, their personal history, and look for other signs that may indicate a genetic mutation that caused, a deleterious mutation that caused the cancer. So ovarian cancer tends to travel with breast cancer. So it's important for women to know that that a strong family history of breast and or ovarian cancer should prompt genetic counseling. The National Comprehensive Cancer Network basically has, they have guidelines for when women should be referred for genetic counseling. A personal diagnosis of ovarian cancer is all you need to be recommended to be seen for genetic counseling. The Society of Gynecologic Oncology also has a statement supporting the fact that women should be referred for genetic counseling if they have this diagnosis. At Mayo Clinic, in 2015, we looked at our genetic counseling referral rates for women with ovarian cancer diagnosis. We did kind of it was a quality improvement project actually, and we defined, what our current rate was, and it was 20%, which really then we weren't compliant essentially with NCCN guidelines. And so we implemented a bundled approach that included patient education, order sets, and referral guideline implementation into the electronic medical record for each woman diagnosed with ovarian cancer, patient education through not just through checklists of risk factors, but also education in the form of a short video that they watched in the hospital after their surgery. And what we were able to do is we were able to increase our rates of referral from our our historic referral rate, which at that time we actually by the time we implemented the project, we actually moved the needle a little bit already. We were at 40% referral rate, but with our quality improvement project, we actually went up to 77% referral rate. So we're continuing to try to refine that because ideally we want to chase 100%, because all of these women really should be seen for genetic counseling and offer genetic testing.